birth of any nation begins with the birth of a child. It's a true fact. And then the development of a nation also begins the development of a child.
There's a real magic that happens when people are all in the room together and have a chance to sort of share strategies, challenges. They find they don't have to recreate the wheel. Often the solution, the wisdom's in the room, and it's just putting people together.
For children living with HIV/AIDS is to realize that they're children, and like all children, they need the best start to life, which is not just education, but is health, it's having access to good environments, it's responsive caregiving.
Because once we take that perspective, we are much more likely to see the broader needs of children, that these children, just like any child, actually needs all the supports, all the environmental sort of richness to flourish and to develop just like any child. So if we can get governmental agencies, if we get policymakers, and actually parents to see beyond the HIV, I think they have a better chance of developing, normally.
We also have noted that they have more vulnerabilities because of the presence of HIV and AIDS in itself, for many reasons. For example, when a caregiver is ailing because she's or he is HIV infected, you realize that they're not in a position to take care of themselves and even take care of the children. So they somehow abdicate their responsibilities as caregivers, and they may end up neglecting their children. That in itself is a child protection issue.
Early child development has really been institutionally the home of the education sector for decades. But with this emerging science, the recognition that the importance of those early years, not to say, as we've heard in the meeting today, it's not intervening in those early years isn't an immunization, it isn't a guarantee of a lifetime of good development outcomes. Those later periods in life are critical, and we need to take a life course approach. But what we have realized is that first 1,000 days, that 0 to 2, 0 to 3 period, is one that hasn't received the attention and resources in these other domains of health and development that it needs to.
Early childhood development programs, actually, if you want quality, it has to embrace culture. Yeah. So, in making the families to participate, to be engaged, then actually you may get results from that. Sometimes in the past we used to have this top-down development. It never worked. But if you really focus on what are the needs in the family, you are sure to get the support of the people.
Everything we need to know now, we have enough evidence that says when you do early interventions, we've got enough efficacy evidence, we've got enough effective evidence that works. We know that. What we don't know is that when those are taken into the real world, what needs to happen? What are the supervision models that work at some level of scale? I'm not necessarily talking about a country level of scale, so what happens is very often we take these studies, they have had lots of supervision, lots of training, and in the real world, everything's got to be, slightly less supervision, slightly less training. We need evidence on how far can you cut? How can you use technology, whether it's mobile phones, tablets, to aid in that supervision process? Not to replace the community health workers, because relationship is fundamental in intervening, but how do we use technology and innovation to help with those, I've sometimes called it soft elements, the supervision, the training, the accountability, to then allow the community health worker to have much more room, space to build relationships, help with problem solving. And so that's the very, very short answer. We need lots more very good implementation evidence.
Hilton Convening is a platform where science and practice meet. We as a people on the ground, we need to get information from the research that the academia are doing, And through that, we are able to improve the way we do our ECD programming. So I have a lot of expectations that, my participation in this convening, it is not only going to help me as an individual to improve my skills on the way I do the work, but also it is going to benefit the community that I'm serving through the improvement in the services that we are providing. Because now we will do, our programs basing on the research, basing on the evidence on what is working and what is not working.
I loved the meeting of this year. I saw there's a difference. And so many things that are coming up is tickling our mind to say, what can I do different? And for me, one of it is strategies. I need to learn. I want to learn what are the strategies we're going to put in place.
There's still a lot to learn, and when you are just by yourself in your specific region, probably you're not getting as much. So definitely this community will be helpful to exchange ideas and experiences.
And early childhood development is key for transforming the world, transforming the society. So what you are doing is great, and this is an important opportunity really to expand the partnership, and in our all efforts we should bring government at the driver's seat to take on leadership and ownership so that we play a catalyzing role in order for government to take over the implementation of nurturing care for early childhood development in a sustainable manner, appreciating the importance of early childhood development in human capital development and economic transformation.
So I think we're recognizing it takes a real multi-pronged approach. Part of it is us funding some different pieces of that, and part of it is ensuring that partners have a platform, again, in country to come together with kind of broader civil society groups. And then finally, it's more attention to how our civil society partners are working with government and including government as part of the discussion. And it's really exciting that we have several government leaders here today, and hearing their perspectives and their recommendations is really an important piece of the puzzle.
Evidence is very, very important. You cannot convince the high-level people if you don't produce evidence. And Hilton Foundation, they have supported our country a lot by sending the technocrats who come and provide evidence to us.
I think what's important is how do you incentivize private sector to work in collaboration with partners to drive early childhood impacts. And I'd like to say that I think we've gone past the age of corporate social responsibility. What we need rather than CSR is SRCs. We need socially responsible corporates. We need to have corporates that are incentivized through what I would call their enlightened self-interest. And what I mean by this is how can we create win-win situations where attracting private sector to work with philanthropy, to work with government in the UN system.
Learning is the very heart and soul of what we do, and the amount of resources that philanthropy has to invest in solving some of the problems we've chosen to address, in this case, young children affected by AIDS, is only a drop in the bucket in terms of what is needed to do that. But if we can demonstrate through learning what are the best ways to address the plight of these young children affected by AIDS, 0 to 5, we can bring others who do have additional resources, whether it's official development assistance, the private sector, or others in philanthropy to invest along with us. So it's learning that really is the basis on which you can build a constituency behind solving these problems.